You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Welcome to Public Health Entrepreneurs, the podcast for leaders transforming public health at the population level. I'm Dr. Charlotte Huntley. Whether your background is in policy, research, technology, pharmacy, environmental science, or another field entirely, if you're building a business focused on population health, this podcast is for you. I bring over 25 years of experience in healthcare, public health, and entrepreneurship to help you build the business strategies that create healthier communities. Today, I'm joined by a special guest. She joins us to share about her journey as a public health professional and entrepreneur. And I think you'll really appreciate learning about this organization, about her journey. I think there's a source of inspiration. I've known her for quite a while, so it's really a treat to catch up with her on this episode and share the resource. You may find that what she's sharing resonates with you, and you'll have the opportunity to connect with her. But I'm excited to connect our conversation for you right now. But before I do that, let me formally introduce her, and then I'll connect. Jennifer McKeever is the founder and managing director of We Public Health, LLC, a woman-owned consulting collective that unites public health entrepreneurs to support leaders and organizations boldly creating a more just and equitable world. A creative, relationship-oriented leader, Jennifer advocates for health equity as a human right. With over 20 years of experience in nonprofit and government sectors, she has dedicated her career to building the capacity of public health systems, organizations, and teams to successfully implement far-reaching public health initiatives. Let's connect our conversation right now. Welcome to Public Health Entrepreneurs. I'm joined today by a dear friend of mine. I'm excited to have Jennifer on the podcast. How are you doing, Jennifer?
Hi, I'm good. Thanks. How are you?
I'm good. Monday afternoon, and we're at the time of this recording. So Mondays are often days I do a lot of my podcast interviews because when I worked full time and started my own business, I thought, I get to create what I want. So my goal was for Mondays to be my favorite day of the week. I was always so frustrated going into work and having to, get boggled down. So Mondays, the way I thought I could make it my favorite day is to have all my podcasting on Mondays. So
that's a good idea. I like that.
Yeah, it's a super busy day, but I do enjoy it. So why don't you take a moment, introduce yourself, tell us a little bit about who you are and what you do.
Sure. Well, thanks for having me. I am Jennifer, and I have worked in the field of public health for coming up on 25 years, which makes me hiccup a little to say that. I remember a time when, early on, I wanted to say, I've got 10 years. And so I would say nearly a decade, right? And now I'm like, I don't want to. Anyway, so I've been in the field of public health for a while now. And most presently, I am the founder and managing director of an organization called We Public Health. And that stands for, the WE is capitalized, and that stands for Women Entrepreneurs in Public Health. And we were founded in 2020, and I've been doing that work ever since. I'm happy to share more about it.
Yes, I'm excited to learn more about it. I remember when I started seeing posts on LinkedIn and hearing people talk about it, and then I've been coaching for a little while and supporting entrepreneurs. So a lot of folks that I helped with their businesses were also a part of the We Public Health community is what I feel like, it's a good word there, the collective.
Mm-hmm.
And then you and I have been in touch for, I guess, about a little over a year.
Yeah, at least, I think.
Yeah, I feel like maybe longer. The time kind of blurs. I don't know. But just like the nature of business, we do have a catch up, things have changed or we pivot a little bit. And so I'm really happy to have this conversation, to have you on this podcast, because I think We Public Health will be a great resource to share more broadly through our podcast. And also, this conversation gives a chance for me to kind of catch up in real time with what's happening and what you're doing. So let's dive a little bit more into that. But before we do, I think it's kind of fun to hear a little bit more about how you started how did you go from wherever you worked to starting? Like what changed in, we said was 2022?
2020.
2020? Okay, so height of the pandemic.
Yep. Right there, right at the beginning of the pandemic, actually.
So yeah.
Yeah, sure. So I guess, I don't think it's an uncommon experience for people to maybe stay in jobs a little longer than they should. And that was certainly the case for me. I was working with an organization where I had been for 14 years, and, the work was great. The work was interesting. But I just had the feeling that, okay, there's something I'm not fulfilled fully, and I can't quite put my finger on why that is. And so for the past, you know, few years in that position, I was talking to a lot of people I knew that had become consultants. And the job just afforded me a lot of contacts around the country. And so I just asked people, why did you become a consultant? And I guess I hadn't really said that's what I want to do, and that I'm determined to do that. But I was just exploring. I was also exploring other jobs at the same time. And so what happened is I created kind of an accidental qualitative study, and that I talked to so many people. I was hearing the same themes over and over from the women in particular who I spoke with who had become consultants. And that was that they chose that path because they felt like they'd reached the end of the road in their 9 to 5, whatever that was. And in some cases it was, there's no, there's no forward here for me because there's not going to be an opportunity for a Black woman in this position, right? Or there's not going to be an opportunity for any woman in this position, or I'm not able to fully be myself and realize my full professional potential. And so that is sort of what drove a lot of people to go out on their own, is to really get to, express their professional potential fully. And, people enjoyed being a consultant. They acknowledged it was scary, but they enjoyed getting to set their own schedules and, have some of the freedoms of, time and agency over what type of work you do. But people missed being part of a team and working collectively and collaboratively as a team. And so that was the sort of original idea behind We Public Health, which was, how do we convene and support women to do work they care about together? And so, the basis of that is, I myself, as a solopreneur in my living room, am probably not going to go after a $5 million public health grant to do work. But maybe with 6 of my amazing colleagues functioning as one team, we can go after that funding together and do really good work. So the idea was that we can have a greater impact together than we can on our own, which is not an original idea. We can benefit our clients and the organizations we work for by having, a diverse set of talented team members who can be pulled in at any time, and ensuring that those team members who are women entrepreneurs are supported to build their businesses, build their capacity in community with other entrepreneurs. So that idea became We Public Health, and it's been 5 years, and I'd say we're really still very much, it still feels experimental. It still feels new, and we're just learning and growing together.
I love that. And I know several people that are part of We Public Health. And it's great to hear, to get the refresher. Like, I think each time we talk, I learn something else that I didn't catch the time before. So I think that's really great. How has, I know, something like a linear progression. So definitely with any business, I think the longer we're in business, things are always pivoting and changing. We're growing, evolving. How now are you growing We Public Health?
I'm not sure why I'm struggling with that. I think it's because it's the time we're in right now, as it feels a little bit more like surviving.
Right, right. So put into context, this is the end of 2025, and it has
Right.
been a survival year. Absolutely
Yeah.
get it.
Yeah. So I think of We Public Health as having two arms. And the first arm is that we go after public health work to bring equity and talent to advance public health in a number of ways. We do that by forming teams of women entrepreneurs to do that work. In order to ensure that we have a solid team of women entrepreneurs, we offer support and community and connection and an environment where women can show up fully as themselves in a way that they have not been able to in their previous work life. And so that means no having to bifurcate my personal life from my professional life, no having to code switch, no having to be a certain way. It's we show up as we are. And because of that security of an environment, I think that allows the women entrepreneurs who are part of our collective to bring them best selves to the clients we work with and do their best work with the clients we work with. So that is the overall model of We Public Health.
Thank you for that, and I really appreciate that. What is just so that we touch on this a little bit more from definitely from the entrepreneur's perspective and the collective understand, can you touch a little bit more on your client perspective, the organization?
Yeah. So we serve clients just like any consulting business would. We get that business through applying for funding, applying for requests for proposals. We get that business through referrals, through repeat work if we go and do a good job. And we have early on been encouraged and pushed to identify what are your services. You need to have a list of services and identify your niche and exactly what you do. And I have been really resistant to that idea because the type of work we can do is based on the talent of the women that are part of the collective, right? And so somebody might join the collective who has a skill in mental health where we haven't worked in mental health before, but we can, and we can support this woman to find, grants and do that work. So I'd been resistant to that idea, but of specifying we do only X, Y, and Z. But over time, we have done some things naturally and been asked to do them again and have developed a bit of a service menu, if you will. And so the areas that we have focused on up until now are a lot of strategic planning or strategic planning like things. So when I say like, I mean, especially post COVID in this world, helping leaders and organizations understand the landscape, like what is happening today and now, and how does my organization need to adapt to serve the communities that I work with in the future. And then we've done traditional strategic plans. We've done a lot of evaluation work. So we do evaluation and then capacity building, really around providing training, facilitation of workshops or technical assistance programs, and that kind of thing. And so we offer services to government, nonprofits, and healthcare organizations to, work on the issues that are important to them. And always for us, there's the focus on equity and bringing an equity. I don't like to say an equity lens because I think it's all equity. So we make sure to bring that into every project that we're working on.
I chuckled a little bit as you described, the strategic planning like projects because, in my consulting business, there's a lot of that I'll say it falls under the umbrella of strategic planning or in the bucket of strategic planning because it's almost for as specific as it sounds, it's still very vague and it could look so many different ways. And you're right. Oftentimes it involves some sort of an assessment,
Mm-hmm.
whatever we're calling it, but it's more recognized as a part of strategic planning. So I definitely get it. I also really like that And this does go against the grain of what most coaches they want you to niche down, and I get it as a coach, and
I
I've
know,
sat
I
with
know
my
it
coach
does.
for years. I sat with my coach for years, and I know what she would say, but I also understand, the model and the perspective that you're coming from, and also, I would imagine that had a lot to do with how you were able to survive this year. Being a little flexible and being able to do different things, definitely understand that view. I wanna go back also to something you mentioned a little bit earlier about entrepreneurs and, women especially, and, the reasons that you were hearing about why people come in, and that resonates with me because that's personally I remember when I started consulting and how I felt. It's that wanting to give more than, feeling restricted or boxed in to some degree. And I've heard that as I've coached other people often. So there's that freedom that comes with entrepreneurship, right? It's one of the wonderful things that people like about this journey. It's also one of the scary things because of that freedom. We have to make the decisions and there isn't that much, that structure to run to for the organization. But really happy to hear, kind of get the overview of how the organization is created and the goals and focus. So if someone is listening and maybe they could be, I'm not gonna put in the blank as far as where they could be on the spectrum of consulting. Maybe they're thinking about it or already started or, already working as a consultant. What would be like an ideal type of entrepreneur to come into the collective? Like how would you describe the ideal scenario for somebody trying to
Yeah.
decide if this is for them or not?
Yeah, I mean, I would say that, I think we could probably serve a number of people in a number of different situations. So if somebody is on the, side of just thinking about it, I'm curious, well, great. We know a lot of people that have done it. Talk to us, we'll hook you up with some people you can talk to, right? Just to get information
Right.
and do that, qualitative study that we've all probably done when we were first exploring this. If you are somebody that is maybe doing some side hustling, like you're working to build your business, but you're still full time working, you could come to We Public Health and be part of a community that you can learn from other women who made that leap from side hustling to full time. And why did they do that? How did they do that? What was key for them to make the decision? So you can, come join our community. We have a couple of membership plans. You could maybe work on a project, on a small scale based on, if you're working full time with us that we get with a client. If you are a full time consultant, working for yourself and mostly by yourself, you can explore becoming a partner with us, which would involve finding opportunities to secure work and do work together, maybe work that you wouldn't have the capacity to do on your own as an individual consultant. And then if you're more advanced, and so maybe you have a few employees or you have several subcontractors you work with, you can come be a part of We Public Health and help us think about, how larger women who are building businesses can connect through sort of a shared ecosystem of collaboration. So I think there's all sorts of ways to engage. And I think the folks who are getting the most out of it are those that are showing up and contributing and building this thing as well. We try to operate as much as possible as like a co op and a shared ownership framework. And so we make decisions collectively. We take action collectively. This is not just my brain, my way or the highway, or, that I sort of set the path. We do this together. And so people that are willing to be part of that and want to contribute to what We Public Health can become and what type of community we can become, I think those are the folks that feel most connected and a level of ownership. They're getting something out of it versus someone who maybe just wants to plug in because they think they might get some work out of it.
Right, right. I can see that. So thank you for explaining that. It sounds like there's a place for everyone really from that thinking about it all the way to really advanced entrepreneur. And I guess I would ask, I explain entrepreneurship is more the umbrella. So as an entrepreneur, you could be a consultant, you could be a book author, you could be a podcast, you could be a course creator, all these different things. So for We Public Health, is it just for consultants, or do you have people who are a variety of these other types of entrepreneurs?
Yeah, that's a good question. I've tended to use those words somewhat interchangeably because it's the words I hear most frequently and how people define themselves. And so I think really what I mean by consultant is working for yourself. And so it is people working for themselves and starting businesses to do that work. And so in that realm, there are people who, like, there are some folks who are specialized in training and curriculum development or specialized specifically in evaluation services or project management. So I would say there's a variety, but the majority of folks, like, the commonality is working for yourself or moving toward working for yourself.
I got it. Yeah. Oh, it's really great to hear, to kind of catch up and fill in some of the gaps. Do you have anything that's coming up that you'd like to tease out or share plans? And of course, not any secrets out, but just as, like I said, time we're recording this, by the time this episode is released, we'll be in the new year, be in
Mhm,
January. So kicking
mhm.
off the new year, thinking about, kind of that timeline. Is there anything that you're looking forward to or excited about that's coming up?
I would want to highlight that this year in 2025, we launched an online community. And so we have an online platform where anybody is welcome to engage and connect with other entrepreneurs who are part of that community in that online platform. And so we have started to see more folks getting involved there and joining that community. And we've started to offer, we have a couple of learning opportunities, a couple of conversation opportunities, and then we facilitate. And what I mean by conversation opportunities is we don't have a structured learning session. We bring people together to talk about issues and facilitate real discussions. So I'm excited to see how that's going to grow over the next year with folks joining that online platform to connect with each other. And then I'll also maybe just highlight a product that we put out recently that I think we're really proud of. It is for public health professionals who are either new in their careers or are maybe going through a transition because of the turmoil in the last year, suddenly finding themselves looking for new work or a job where they hadn't before. And so we developed a resource called Your Public Health Career: Building Blocks for a Purpose-Driven Career in Public Health. And it is a workbook that helps people walk through really designing and charting the career that they want for themselves. And so that's available on our website, and we're pretty proud of that resource. We developed that, I should say as well. I should have probably said this at the beginning, but we developed that with the American Public Health Association and for the American Public Health Association.
Oh, okay. Nice. That's a great resource. So we'll make sure that we, in the show notes for this episode, link where people can connect to you.
Great.
Um, this has been a great conversation. I feel like I'm really caught up. My mind is kind of ticking with thoughts and ideas. As we begin to wrap up, is there anything else that you would like to share, raise, ask, or bring up that we haven't touched on already? That gives me a chance to make sure we've covered it. If there's not something pressing on your mind or heart that you'd like to share that I haven't raised the right question for yet.
Maybe just some words of encouragement for anybody that finds themselves facing, whether by choice or not by choice, this idea of working for themselves. And that is that, part of my 25 years of experience means I've worked with a lot of people and engaged with a lot of people. And one of the things I've seen and continue to see, and it is particularly true of women, is not fully embracing and not selling, but owning the skills and talents that they do have. And I have found through this journey that I have learned just in the last 5 years, so much more about myself and my capacities than I did in the previous 20 years of, working for other people. And so there is a lot of support. There is a lot of resources. There are a lot of us who are choosing this path, scary though it may seem. And if you think you can't do it, you can. That's
I
all
think
I want
that's
to say.
wonderful. Yeah, I appreciate that. And I know my audience does too. I think that's a great way, not only encourage some people, reminders for others, great demonstration of, we're better together, we're stronger together. I think women naturally do that. We lift each other up. It's just very intuitive for us to do that. So I appreciate you for sharing that. It's a great way to wrap up our conversation as well. What is the website? Of course, we're going to add it to the show notes, but just for someone who's listening, where would you send them to connect with you, though?
Yeah, our website is wepublichealth.com. So just wepublichealth.com.
All right. Well, thank you so much, Jennifer, for taking time. I think, at some point in the future, we're going to have you come back for another update. But
Okay.
thank you for making time to come and share and for the amazing work that you're doing with We Public Health.
Yeah, likewise. I was happy to do it. So thank you.
I hope you enjoyed that conversation. You can find the links to connect with Jennifer on the show notes page for this episode at publichealthentrepreneurs.com. Make sure that you also subscribe to our Public Health Entrepreneurs newsletter so that you receive updates about our podcast, programs, and events. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.